Okay, so if you've ever had an injury or some kind of chronic pain, you've probably found yourself facing a really confusing choice. Should I see a physiotherapist or a physical therapist? I mean, they sound almost exactly the same, and people use the terms interchangeably all the time. But are they? When you're in pain, the absolute last thing you need is more confusion. So let's clear this up once and for all and figure out what these terms actually mean and which one might be the right call for you.
Here's what we're going to cover in this explainer. First, we'll dive right into that common confusion. Then, we'll define physiotherapy and physical therapy separately to really see what they're all about. We'll uncover the key, subtle differences, and then we'll bring chiropractic care into the mix to see how it fits. After that, we'll look at an integrated approach and wrap up with a straightforward guide to help you decide which treatment might be best for you. So let's just start with the problem itself, right? You're hurting, you start doing some research online, you talk to your doctor, and bam, you're hit with this wall of different terms. It honestly feels like you need a secret decoder ring just to figure out what your options are.
And this really is the big question, isn't it? Your doctor here might tell you to get physical therapy, but your friend who lives in, say, the UK or Australia just swears by their physio. Are they talking about the same thing? Is one of them a better choice for what you're dealing with?
Yeah, it's a totally valid point of confusion. But you know what? The answer is actually way simpler than it seems. To get to the bottom of it, we just need to look at how each one is defined and, maybe most importantly, where in the world you're hearing the term.
So, to really understand how these two compare, we've got to build a solid foundation first. Let's look at each practice on its own, and we'll kick things off with physiotherapy.
Think of physiotherapy as a really hands-on strategy to get you moving again. The therapist is using manual techniques, guided exercises. They're not just treating the symptom. They're actually helping your body relearn how to work the right way after an injury or an illness.
A physiotherapist can tackle a whole range of issues. This could be anything from helping you recover after a knee replacement to treating that nagging sports injury that just won't go away, or even creating a plan to help you overcome chronic joint stiffness and muscle weakness.
All right, now let's flip over to physical therapy. So, the goal here? It's exactly the same. Help you move better and feel less pain. The number one distinction that our source points out is basically geography. If you're in the United States, you are way more likely to hear the term physical therapy.
Now check out the conditions treated here. Back and neck pain, arthritis, problems with your posture. If that list sounds really familiar, well, it should. This huge overlap with physiotherapy is probably the biggest clue we have about the real relationship between these two terms.
Okay, so we've established they treat a lot of the same conditions and they have the same end goal. So, if there are any differences, what are they? Let's break down some of the more subtle distinctions.
This is where you can kind of see the slight nuances. While the goals are the same, physiotherapy is often seen as having a more hands-on, manual approach. It's focused on the body's entire movement system, very holistic. On the other hand, physical therapy in the US might sometimes be linked more with structured rehab programs that use specific equipment. But really, let's be honest, the biggest difference is just the name.
And there you have it. This is the main takeaway, all in one quote from the source. Are they the same thing? For the most part, yeah, they are. The education, the goals, the treatments, they're all incredibly similar. The name you hear just depends on where you happen to be on the map. All right, now that we've cleared up that whole physio versus physical therapy debate, let's bring a third major player into the conversation, chiropractic care. This is where the focus really does shift quite a bit.
So while physio and physical therapy are looking broadly at muscles and movement, chiropractic care zooms in on one specific, super important area, the spine. The core idea is that the health of your spine has a direct impact on your nervous system, and by extension, your entire body's ability to function.
So we have these different approaches, right? And it's not about one being better than the other. In fact, they can often be way more powerful when they work together.
Now, it is important to point out that our source for this explainer comes from a chiropractic center, and they really highlight the value of creating an integrated plan. They find that a lot of patients get the best results when they combine the spinal focus of chiropractic with the muscle and movement work of physical therapy.
And this synergy is exactly why an integrated approach can be so effective. When you address both the skeletal structure and the muscles that support it, you're getting a much more complete solution. This can lead to better mobility, less nerve pressure, a faster recovery, and a much lower chance of that annoying pain coming back. So all of this brings us to the most important question. What does this all mean for you? With all this info, how can you actually make a smart choice for your own recovery? Think of this guide as a great way to figure out your starting point. If your main goal is to rebuild strength and mobility after a specific injury or surgery, then physio or physical therapy is probably your best first call. But if your pain is more chronic, it's related to your neck or back, and you're worried about your posture or alignment, well, chiropractic care is specifically designed for those issues. And like we just talked about, sometimes the most powerful solution involves a little bit of both.
Ultimately, knowing the difference between these therapies isn't about picking a winner. It's about being an informed patient who can advocate for themselves. Whether you start with physio, physical therapy, or chiropractic, the shared goal is to help you move better and live with less pain. The best first step is always just talking to a professional to build a plan that's right for you. So, what's the first step on your recovery journey going to be?